So fertility is obviously a big issue for both men and women, and when they're starting to undergo chemotherapy treatment. And I suppose it starts first of all when the patient is diagnosed in clinic. So we want to catch people as early as possible to let them know that fertility preservation is an option for them, especially because some people may be planning a family, or some people may not be exactly there yet. So for women, there's different types of fertility preservation, such as egg freezing, of course, embryo freezing, and a new one which is called ovarian tissue freezing. And of course, for men, we have sperm banking as well. I suppose the main thing to be most aware of when patients are starting chemotherapy is there is actually that sort of time lapse that they need to be aware of if they are going to undergo fertility preservation, and that can be up to 6 weeks. So I think if you compare that with different key performance indicators with regarding to treating patients with chemotherapy, I suppose they're meant to be treated within that 4 to 6 week timeline. So we need to be, I suppose, educating patients as soon as possible when they come into clinic about their options for fertility. And sometimes the consultant will bring it up, and sometimes the nurse will bring it up. So it's always okay to interject. And it's important to know that anybody can bring that up at any stage in the patient's treatment. And also there's actually the option in females for the use of glyceryl or Zolidix, which is like a monthly or 3 monthly injection that patients can take, and basically that closes down ovarian function. Every hospital is different, but some of the policies I've came across working in London and Ireland is that they wouldn't recommend patients to start a family for 2 years post chemotherapy experience, just in case, we'll say, the cancer does actually return or gives them that option.